I'm Dr. Lisa Iucci. I am a general surgeon and breast surgeon, board certified in general surgery, and I work here at the Premier Surgical Network. Here at Premier Surgical Network, we treat all types of skin lesions, whether they are benign or non-cancerous or cancerous. So right now I was just going to focus on the benign lesions. Some things that people may notice on their skin are some abnormal growths that are bumps or lumps of some sort, and those can typically be just growths under the skin. One of them could be from a cyst. Another cause could be a lipoma, which is just a growth of fatty tissue. Both of these, again, are not concerning for any type of cancer, but a lot of times they're bothersome to the patient cosmetically. The cysts also have a risk of getting infected, and that can cause a whole nother issue for the patient, as far as sometimes they might need to be drained in the emergency department or here in the office if there is an active infection. The treatment options for skin lesions, including cysts or lipomas, is surgical excision. Depending on the location and the size of that cyst, as well as the patient's comfort level, we can do them here in the office. We use local numbing medication, and we're able to take that area out. Again, if it is in a difficult location or it's a very large size, sometimes it requires a further surgical excision that would be in an operating room setting. One of the biggest benefits of getting a skin lesion treated here at Premier Surgical Network is we do have a procedure room in the office, so we're able to do smaller procedures here on site. It doesn't require the patient to have to go to a surgery center or a hospital, and they can just come here and do it in the office. If you have a lesion that you're concerned about, I would get it checked out. Again, I would stop maybe at your primary care physician and have them look at it first, or a dermatologist if you do have a dermatologist you see regularly. A lot of times these lesions that are under the skin, like a cyst or a lipoma, a fatty tissue growth, are non-cancerous. There is always a chance that there could be cancer within them, but it's very rare. So I would say if you have any concerns, I would just have it checked out, and we can always excise it here in the office if possible, or you can continue to monitor it until it becomes something that you are uncomfortable with. The recovery after removal of one of these skin lesions varies greatly on the size of the lesion as well as the location of the lesion. A lot of these lesions are just within the skin itself, so just excising that area and putting stitches under the skin is enough, and those patients have minimal recovery of about a week's time. If the lesion is larger or it is down to the muscle area, the excision and removal is more extensive, and it might require stitches on the outside, which would have to be removed here in the office, and it might require longer recovery period. To take advantage of the treatment options we have here at Premier Surgical Network for any skin lesion that you may have, a lump or a bump or a concerning sign of malignancy, is to stop in and get an appointment. One of the best things is to physically look at these lesions and to determine if anything further is needed. If you come in for a consultation, we'll see you and evaluate that lesion and determine what the next step is necessary.